Hello friends, welcome to Nursing in Health. Today I will discuss about tuberculosis, most infectious disease in our community. It is a contagious infection that usually attacks lungs. It can also spread to other parts of body like brain and spine except hair, nail and tooth. Agent Mycobacterium tuberculosis. Host age all age group. Sex more prevalent in male than female. Nutrition those persons are more prone who are in malnutrition due to poor resistance. Immunity those persons are more prone for tuberculosis who have poor immunity, just like HIV, chemotherapy, etc. Environment poor quality of life, poor housing condition, overcrowding area, population explosion, malnutrition, lack of education or awareness, early marriage, etc. Mode of transmission droplet infection. Droplets are generated by coughing and sneezing. Tuberculosis is transmitted by vomits such as dishes and other articles such as handkerchief used by patient or TB infected person. Next, we know about TB vulnerable group or who are more prone for tuberculosis. Age more than 60 years. Malnourished or BMI less than 18.5. Long-term treatment for diabetes mellitus, smoking or alcohol intake, past TB history, household contact with TB patient, history of HIV. Now we know about clinical manifestation. First, we know about 10 S of tuberculosis. Persistent cough more than 2 weeks, fever more than 2 weeks, chest pain, weight loss, shortness of breath, coughing up blood or hemoptysis, night sweats, loss of appetite or anorexia, fatigue, swelling in neck or other extrapulmonary sign or symptom. Next, we know about types of tuberculosis. Pulmonary TB and extrapulmonary TB. Pulmonary TB means tuberculosis which affect the lungs and extrapulmonary TB means which affect other organ than the lungs. Next, we know about diagnostic procedure for tuberculosis. First procedure is Mantoux test, injecting a small amount of PPD or purified protein derivative under the skin and measuring the reaction 2 to 3 days later. Reading the test, induration and erythema. Result, induration size if less than 5 mm, result is negative, and induration size is more than or equal to 5 mm, result is positive. Now we know if any one of 10S is present in vulnerable group, how we started the diagnostic procedure. If availability of NAT test, do NAT test. If not available, do microscopy test of sputum. If NAT or microscopy test is positive, start anti-tuberculosis treatment. NAT or microscopy if negative, do chest X-ray. If chest X-ray is suggestive of pulmonary TB, consult with MO and started anti-TB treatment. If chest X-ray is normal, perform Psi-TB intradermal skin test. Psi-TB is positive, so start the TPT with 6 INH or 3 HB. And Psi-TB if negative, screen for 10S in 3-month interval. TPT dose for all family members, medicine single dose of isoniazid. Dose of medicine depend upon age and body weight. Age less than 10 years, medicine dose, isoniazid dose is 10 mg per kg body weight, and age more than 10 years, isoniazid dose 5 mg per kg body weight. And if vulnerable population is asymptomatic, do chest X-ray if possible. Chest X-ray if positive, start anti-TB treatment, and if chest X-ray is normal, perform Psi-TB test, and if Psi-TB test is positive, start TPT, and if Psi-TB is negative, regular screening of the person in 3-month interval. Anti-TB drug. First line drugs of tuberculosis are isoniazid, rifampicin, pyrazinamide, ethambutol, streptomycin. Second line drugs are kanamycin, ethionamide, cycloserine, capreomycin, etc. And newer drugs are ciprofloxacin, ofloxacin, azithromycin, and bedaquiline, etc. General treatment of new case for tuberculosis start with 99 dots or It means 99% of cure. Its medicine depend upon age and body weight. Available medicine dose is pediatric tablet 100 mg and adult tablet 300 mg. Dots includes HRZE or isoniazid rifampicin and pyrazinamide and ethambutol, which adult dose includes isoniazid 75 mg, rifampicin 150 mg, pyrazinamide 400 mg and ethambutol 275 mg. Dose according to age and body weight is presented here. Now we know about MDR-TB. MDR-TB means multiple drug resistant TB. MDR-TB means whose sputum culture is positive but resistant in vitro to at least isoniazid and rifampicin. Its treatment intensive phase 6 to 9 months and continuation phase 18 months. Drugs are kanamycin, ofloxacin, ethambutol, ethionamide, etc. as per doctor. XDR-TB, extensively drug-resistant TB, subset of MDR-TB, where the bacilli, in addition to being resistant to rifampicin and isoniazid, and also resistant to any one of the fluoroquinolone or second-line injectable drug, kanamycin, amikacin, etc. Prevention of tuberculosis, primary, secondary, tertiary. Primary prevention, BCG vaccination, avoid close contact with TB patient, avoid overcrowding area, take nutritious diet, avoid smoking and alcohol, use masks, proper hand washing before touching nose and mouth. Secondary prevention, early diagnosis and immediate start treatment and take proper diet. Tertiary, provide mental support, increase awareness about TB among community people and aware people about complication of TB medicine, educate them when contact with doctor. Thanks for watching. Please like, share, comment in video and subscribe my channel.